call the public safety meeting to order. The first thing on the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Yi, can you hear us?
Yes, I can hear you.
Okay, thank you. Okay, number 3, public comment. Do we have anybody to make public comment today? Anybody online? No? Thank you. Number 4, approval of the March 11th, 2025 Public Safety Committee meeting minutes. I need a motion. Tim Sandelsky and Jason second. Any discussion or changes? All in favor, say aye. Aye. Opposed?
Aye.
Okay. Minutes are approved. Number 5, policy issues, discussion, and potential committee determination, none. Number 6, operational functions required by statute, ordinance, resolution, or policy. A, discussion and possible action by public safety. If it's okay with the committee, we would like to move from 6B to 7A as a little bit of a time crunch thing, if it's okay with everybody. Okay, all right, then we'll go to 7, educational presentations and committee discussion. 7A, 2024 strategic plan review and updates. Number 1, primary objectives, 7.1, and secondary objectives, 3.3, 3.7, and 7.2. And Vice Chair Dickinson is going to lead us on this.
Thank you, Madam Chair. So I appreciate the consideration to move up this on your agenda. So really what we're doing at this point is looking at our strategic plan, the current strategic plan, and just reviewing basically the outcome measures to see whether the committee and the department heads have met those goals that were set forth. So just as a little background, the current strategic plan was passed by the board in 2018. There was a revision that was done in 2023 due to the COVID issues that we had, where we couldn't meet some of those outcomes and we needed an extension. Most of those outcome measures lasted through 2024. So this is really a discussion on putting a bow on that, not making any changes to the current strategic plan or any updates, but the updates and review as it pertains to whether those things were met. As you know, we're going through a new comprehensive plan, which will come out next year, and then from that, a new strategic plan would be passed for the next 5 years. So this would be that discussion about that. So the first, I'll start off here. The first one, as you have here, is the primary objectives of 7.1. Administrator Leonard, had you wanted to comment to that, or would you like me to speak through that? How would you prefer?
If you want to start, and then I can pull up we were able to get data for each of the areas I think the vice chair wants to talk through relative to the outcome measures, but certainly if you want to tee us up.
Sure. So the only primary objective that public safety had as lead was objective 7.1, which is to provide cost-effective and high-quality public safety services. Of those, there's 2 outcome measures. The first one, by December 31st, 2024, emergency response times for public safety will decrease.
Sure. Thank you, Mr. Chair. And I'm starting with the data measure where I probably have the least to offer in terms of substantive updates, but I was able to meet with Chief Deputy Milhausen earlier today. He's unable to be here due to some conflict, but this is an area that this committee has talked about a fair amount over the last, it's one of those topics of county government that has kind of percolated for a long time. And kind of the background here again is the idea that individual municipalities, including towns within the county, are ultimately responsible for the primary response, particularly as it relates to EMS. And what that results in is we have a lot of individuals, so I'll say fire and EMS districts. So if you live in the city of Wausau, you might have the Wausau Fire Department that would provide both response rates for EMS and fire. Whereas if you live in a rural part of the community, you might rely upon a non-fully staffed, volunteer-based fire department, and your town may in fact contract, or it may contract with another municipality. But again, that on the EMS side, that is truly a municipal obligation. With respect to law enforcement, again, a little bit of a permutation there. If you live in the city of Wausau, or if you're in Weston, for example, or an incorporated municipality, you may, under statute, have a requirement that your municipality deliver your law enforcement. But here, the county has an obligation as well, right? Our sheriff's office. So across the board, in terms of emergency response, the sheriff's office is involved through our dispatch obligations. But depending on the specific nature of the request for response, the county's role, if any, can look fundamentally different. If it's fire or EMS related, our role ends with the dispatch and ongoing monitoring through our communications center. So this has frequently come up under the guise of should the county pursue a county consolidated EMS, centralized EMS system. There are a few counties in the state that do that. The majority do not. The chief deputy they're cleaning up the 2024 data. We had some system issues with the 2023 data, and he'll come back and report to you. But essentially, this is my characterization based on the information he sent me earlier today. We really do have, again, based on where you live, there's that fundamental difference that I referenced before. If you live in an area where you're on the EMS side, fire and EMS, where your response is based on you're in the metro area and you have a fully staffed, either 24/7 or largely 24/7 department, your response times, both in terms of when you are dispatched and the time between dispatch to on scene, are significantly less than you would see in the rural area, where we rely upon either a contracted service that is coming from a further distance or a volunteer, non-fully 24/7 staff department, which is not surprising, right? That makes logical sense. Our emergency management director has presented a number of times to this committee over the last several years about some of those challenges. We actually, in pursuit of this strategic plan objective, worked with the University of Wisconsin through their University Year program to have them do an evaluation of emergency medical response times, and that came to this committee. So long-winded way of saying we'll have more data for you on that. Over the last several years, I wouldn't say there's been a fundamental change. That's my characterization, and I'll allow the chief deputy to add further information when he's able to appear before the committee, but we have not seen a substantial improvement in terms of response times that we've seen from our various agencies. We have made some changes to how we dispatch to try to improve that. We used to wait for a longer period of time before when we would dispatch a particular service. We would wait, I can't remember and I'll allow the chief deputy to clarify, but we would wait X number of minutes before we would page a different entity to respond. We made some changes to that to try to improve that response time after consulting with our local EMS and fire providers. But I wouldn't say there's been a substantial improvement over the term of this strategic plan in terms of response times. We also haven't gotten direction from this committee or the county board to really evaluate consolidated emergency medical service response. The county does not have the legal ability to take on fire response. It's a specific provision within the Wisconsin statutes about what you're allowed to levy for in terms of services, and that limit is where it relates to emergency medical services. As it relates to the second outcome measure, by the end of 2023, the Public Safety Committee will issue a white paper for consideration by the county board that identifies strategies to address the shortage of state public defenders and attorneys accepting public defender appointments in Marathon County. So there was a presentation given in July of 2023. This was a topic that was taken up by the Criminal Justice Coordinating Council. Judge O'Neill appeared before this committee and kind of broke down a number of recommendations that the CJCC had looked at to potentially move forward to try to improve the timeliness and the lack of supply of attorneys taking those appointments. Ultimately, nothing moved forward out of this committee to the full board for allocation of funds, but I can report that there are a number of things that ultimately the clerk of courts, after consulting with and working with the CJCC, a couple of those recommendations have moved forward. One of them was the idea of interim billing. So under our old practice with respect to individuals taking appointments, if you took a county appointment through the courts, you would have to wait until the case was closed to ultimately submit your bill, which would then be paid based on the fact that it's a county appointment. And that was a barrier. It was identified by a number of attorneys as a potential barrier to taking the case. So again, I think everyone on this committee appreciates that sometimes our cases in the justice system take some period of time, right? You accept an appointment, maybe the case is 9 months long. So the fact that you would incur all those expenses but be unable to bill for the entire period of that case could serve as a barrier. Well, the clerk of courts worked with our finance department to address that, and we do now allow for interim billing. So that has moved forward. Similarly, one of the pieces of feedback that the Criminal Justice Coordinating Council got from the lawyers that were on the appointment list, and that number has been shrinking. It's quite honestly a very short list. But some lawyers had indicated that it would be nicer if before they received an appointment from a court, the court had some sort of dialogue with them on the front end. Hey, this is the type of case it is. Would you be willing to accept this appointment? Which is different than what we had done before. We would hold what are called indigency hearings. The court would make a determination, say, yes, this individual is eligible for a court-appointed attorney. And then they would just work off the list and say, hey, we're going to appoint Attorney John Smith. Some lawyers had indicated that, I got off the list because there are some cases I would be willing to take, but I can't agree to take everything just based on what comes through. And so then when they would be appointed, they would later have to then turn down that appointment. It delays cases. So our judges, a number of judges have worked to implement a different practice where there's kind of that initial outreach to them, which has been received well. So with respect to 7.1, a number of things have moved forward. I would say with respect to outcome measure number 2, this actually does relate very well to the topic under 6B1 on your agenda. Consideration by this committee whether or not you wish to take a position relative to advocating to the state of Wisconsin whether or not to fund some criminal justice related initiatives, particularly the circuit court funding and the Justice Coalition funding that is in your packet, because of course the state is obligated, it is their obligation relative to public defender appointments. So on that, I'm happy to take any questions. And if this committee does want the formal white paper that the CJCC worked on, again, we presented it in July of 23, but that a formal paper was issued. We can certainly bring that back for your further review. But back in 2023, there was no action taken by the committee at the time. But happy to answer any questions about at least 7.1 right now.
At one point, we talked about townships maybe getting together and doing, what's a regional type thing.
Yeah.
And there was a lot of pushback. Has anybody, everybody has their own turf, and at some point, people didn't want to share. I don't know how else to put it. But has that ever gone forward at all? Has anybody ever talked, has Phil talked to them, or?
So we do continue to have, certainly we continue to interface with the local emergency service providers. We actually recently at a Towns Association meeting had our emergency management director present along with going to get the title wrong, I'm sure, but the president or head of the MABUS group, which is the mobile alarm box system response for fire and EMS. So we continue to interface with them. I have not had, I can't recall the last time a township representative or municipal representative reached out to make inquiry of me relative to the idea of the county taking on or moving forward with discussions at this committee about taking on the idea of a consolidated or centralized emergency medical service response. There are, SAFER, for example, is a regional fire and EMS response. There was recent discussion about merging, I believe it was Riverside, into SAFER. But I don't believe that moved forward. I could be off base on that, so don't hold me to it. But I do believe those conversations were ongoing, but Riverside ultimately moved forward with recruiting a new chief for their fire and EMS. So I don't believe there's been further discussions, at least not that I've been part of. They certainly can be happening.
Well,
within
I was referring to the townships doing some cost sharing and having their own little regions. I mean, we've got a huge county.
Yes.
And so, we'll go all the way out to Athens or all the way down almost to Marshfield. But everything in between the response time is getting worse for these people because they're so far away unless they have their own facilities. And I think some of them do have on-call ambulance. I just can't remember who they all are anymore. It's been so long since we had that conversation.
I'll have I know the chief deputy, when he sent me the data this morning, they do have it broken out by municipality. Again, it's kind of nuanced based on the nature of the specific response that's requested. I don't believe our data is segregated in that form or fashion, but there certainly is a difference when you look at, and we do call it out, rural versus kind of metro responses.
Go ahead.
I did get a chance to talk to a town representative, just try to get a little input on that. And they were definitely against the county consolidating everything. If we discuss it more, I'll get more input, but just from the town side, they were happy with what they had. But it would be something to get some input on.
Well, and I was referring to the townships getting together, and forming their own, so that they're protecting their area. If they could, blend their funds together and maybe save. I know they can't have 24/7 on call or full-time, but you might have people closer to home on call for, some of these areas. It has been a long time since we had that conversation.
Yeah, I'll be honest, I haven't had anyone reach out. I think my sense is it ebbs and flows. I certainly have had conversations, and municipal representatives have reached out, town officials saying, hey, we think it would be nice if the county took this on. But to your point, there are certainly other officials that have a different perspective on that. If the county wants to further evaluate this it was being considered to be added to the administrator's work plan a couple of years ago, but ultimately didn't gain traction to get added. It would be a big undertaking. I know I've spoken with a number of my colleagues, namely, Ashland and Bayfield have done some work to integrate and share communications response. But there are a handful of counties that have taken on EMS response. If you recall from the work we did with the University of Wisconsin, one of the big barriers to that, it's a staffing issue. It's a very challenging work to staff, particularly when Madam Vice Chair is talking about volunteer departments. It's very hard to staff volunteer departments, particularly in light of the fact that the requirements for volunteers, when you think about EMS, they continue to grow to make sure that you have individuals that are sufficiently trained to be able to respond in a meaningful way. When it's essentially you're asking someone to volunteer, many of them are paid volunteers, but not enough to make it financially worth their while, but there is some compensation there. But it's a lot of hours, annual hours of certification to do that work. So it's very difficult. And some employers aren't as flexible as perhaps employers used to be in the past to allow individuals to, at a moment's notice, take off of work to go respond. So it's a very challenging area.
A lot of our volunteers are also aging out, and there are very few that come back in, and that's making it even harder. So I was just looking at what I have here. In 2022, we had a lot of stuff that was already done, but we did the enhancement of our 911 and E911 services. We have continuing support of our drug court and OWI court. The mutual agreement between WASA and the county hazmat response, that's done. Monitored response times for rural fire and ambulance, that's always going to be ongoing. The Forensic Science Center, that's done. And the Central Wisconsin Narcotic Task Force, that's ongoing yet, okay.
So then the other objectives, they're secondary, 3.3, 3.7, and 7.2. HHS had the lead on those, so we did discuss those in that meeting. So I'll give it to Lance how you want to kind of summarize that to step through. Because there's really, I don't know how many would be particularly for public safety to be directed to.
Sure, I can, I know I have some information up on the screen, so I'll start with that and then certainly take additional questions. So if we look at, you have to give me a minute on 3.3, but I can start with 3.7, and as you have that discussion, I will find the 3.3 information. But as it relates to objective 3.7, as the vice chair referenced, this committee is identified as a support committee. You weren't the lead committee on the work here, but certainly of interest. The first outcome measure by December 31st, 2024, the number of chapter 5115 emergency detentions in Marathon County will decrease. Again, just to ground everyone why that's important. Historically, it has been our experience that if law enforcement are frequently that first point of contact into the emergency mental health system, so law enforcement are dispatched to respond to a situation where an individual is in mental health crisis, and ensuring that we have sufficient emergency mental health resources is a good thing because it keeps those individuals from starting within our criminal justice system, which is just not the right system for those individuals to be in. So on Marathon County Pulse, this is a place where we collect a lot of data. One of the data points we do collect is the number of emergency detentions. And so I have that up on your screen. You'll see from 2016 consistently going down to 2023, and we do have some 2024 data that I'll share in just a little bit. But you'll see we have had a lot of work in this area, things like our crisis assessment response team, things like training all law enforcement in the county, and not only sheriff's office, but working with other municipal agencies to train them on crisis intervention training, which helps our law enforcement professionals better identify when someone's in mental health crisis. And a number of other strategies. We've been really trying to bring those number of emergency detentions down. You see, we've been pretty successful. Looking back to 2016, there were just nearly 500. And now, again, in 2023, it was 225. I will say our data for 2024, there was an uptick about to 339 is the tentative number I was provided today. So it's not in the system as of yet, and we'll have to dive into kind of why. My initial look at that is the agency with the largest increase was Wausau Police Department, or the city of Wausau, I should say, with interactions that led to detention. But even then, our numbers back in 2016 were 482. We've continued to see that work come down. And emergency detentions are ultimately handled by Mike's office. So it's a system from law enforcement to North Central Healthcare and ultimately to our courts, and handled by Corporation Counsel. So good progress, still plenty of work to do, but emergency detentions, I think, have steadily gone down. It's not surprising that we'd have an uptick. I mean, I think I say it frequently, there are sometimes things are challenging with respect to access for mental health care. And individuals, when they have those challenges, we need to make sure we meet them where they are. But happy to answer any questions. Mike, did I miss anything that you want to add?
Not that I can think of.
So do we still have the psychiatry residency program in Marathon County?
The medical college
Does?
does continue to do that, yes.
So has that had an impact? Because at some point, people who had crisis on a weekend, if there wasn't a psychiatrist available, they couldn't get their meds. So I would think that that's been helping too.
I can only speak from my interaction with the system through our North Central Healthcare partners. I know that having those residents available has definitely increased the availability of care to those inpatient and outpatient who are getting care through North Central Healthcare, and that's really the center of all those crisis referrals that we're talking about. So I would say, yes, it's had a really positive impact on the availability, just from my view and perspective.
Good, thank you. Any questions or comments from anyone else? What else did we do?
All right, the other outcome measure for 3.7, by the end of '24, the percentage of life report community survey respondents who reported not seeing a mental health provider when needed will be less than 20%, and barriers to mental health care will be reduced. So again, you can look on Marathon County Pulse, and you can pull up the data point about county residents that they should have seen a mental health provider but did not. Our percentages here have increased over the last several years. And I don't have a great explanation. I think my sense is it's a function of a couple of things. So this is a survey that goes out, and it's currently out right now. If anyone wants to take the life report survey, you can access that via the health department. And this is one question that is asked. Have you or someone in your family not seen a mental health provider when you think you should have? Part of that, I think it's a positive that our community talks more, and just nationally, we talk more about the need for mental health services, which is a good thing to kind of normalize that. We have work to expand, as Mike just alluded to, through some of our programs, access. But I certainly think it's fair to say that even since this strategic plan started in 2018 and our data was 2017, but when you're at 19%, and now we're up to 23% answering that question in a way where, more access is needed. There are a number of things we've worked to do, whether it's the psychiatry program, work with schools to enhance access and destigmatize mental health, or again, our crisis assessment response team, expanding outpatient clinic options. There's just not enough. So if there are questions, I can try to answer them, or perhaps more likely is get you additional information. Any other questions?
No, I guess not. Go ahead.
And then the last measure for objective 3.7, number 3, is by 2024, the annual number of deaths by suicide will decrease. The baseline in 2021 was 21. That data also is available on Marathon County Pulse for the county, and you can see here that those numbers have, I would say, been relatively consistent. If you go back to 2017, that number, as you can see, is 20. The highest it has been was 2023 at 26. I can report in 24, the numbers that I've received at this point was a drop to 25. So that will be updated shortly. Yeah, go ahead.
Now, when it comes to suicide, are factors looked at of why somebody committed suicide?
Great question, absolutely. And Jess is here if she wants to chime in. But one of the programs that I think we're really proud of and a leader in the state on is our suicide death review team. So what they do is exactly what you just alluded to, but I'll not steal Jess's thunder. You can kind of walk through what the team is and what you guys do to try to improve care and coordination.
So, having a nursing background, I am very passionate about prevention. So most medical examiners' offices, when they have a suicide, they do their investigation, they determine it's a suicide, and then that's the end of it. They don't really care about what led to that point and what other factors could have been part of it. So my team has a very large, comprehensive list of questions that they ask the families, a lot of different demographic information about their childhood, any previous traumas, mental health issues, interpersonal problems, if there's any financial hardships or whatever was going around at that person's life, we like to gather that information. So in our database, we're able to store all of that information and run customized statistics. So if I want to know about men over the age of 60 who have committed suicide, I can run those reports to see what are the most largest factors that all of those cases have in common. So we do gather all of that information. So then the one nice thing that I'm really excited and passionate about, and I believe it was in 2022, either 2021 or 2022, we were the 5th county in the state to develop a suicide death review team, which is one of the best practice things to do. So we do have a group of professionals from all different city, county, private sector workforces that are all intertwined that come to the meetings where we review 2 suicides 6 times a year, where we're able to dive into the prevention side of things. And having all the different key players around the table really helps facilitate a lot of great discussion and a lot of really good positive outcomes. Between all of our death review teams, the suicide death review team has been the one that pushes forward the fastest of making changes and doing different things between the health systems, and it's been a very positive outcome. Unfortunately, like Administrator Leonard said, our numbers have been relatively high. 25 is our average over the last several years as the highest that we've had in 3 of the last 10 years have been 25, and 1 has been 26. So that the 21 mark was a little bit lower than our average, which is obviously still way too high than what we should have. But that's kind of just an overview. Does anyone have any questions on how we do our investigations or the suicide death review team?
What all does it entail?
For the death review team, so we do have 3 death review teams in Marathon County. We have the child death review team, the fatal overdose review team, and the suicide death review team. So what we do is our office would select whatever case is that we will review for that month. And all teams have the same setup just for consistency. I like them to be managed the same, where it starts out with our office providing some of the basic information. Then law enforcement who attends a meeting provides their information on the investigation. Then it comes back to our office where we talk about the autopsy findings or the toxicology and kind of like our overall of what the cause and manner of death is. And then it goes to our community partners. Depending on what type of case you're reviewing, you're going to have different input for different providers. So, for example, if you had a child suicide, you're probably going to have someone from the school districts talk about what they did in the schools and what they've done since that to support the other students and different prevention measures. You would have the physicians, mental health providers. Who else is the main one? Corporation Counsel. If it's like the overdose review team, you'll have representatives from the district attorney's office. And then, like I said, we go through and talk about that person's life, kind of the factors leading up to it. And then at the end, the facilitator from the health department, it's one of the health educators, discusses of, do we have all the information? Is there anything else that we're missing? If there's more information or if anyone has questions, that's a good time to have a lot of more open group discussion. And then we go into the prevention discussion if there's anything that could have been different or any suggestions that any of the professionals have. And then afterwards, we try to figure out who is the best agency to follow through on that recommendation. And all the recommendations are evidence-based, that we just don't say, someone says, oh, you should look at this, that the health department goes back, or whoever is the lead agency who knows that area looks to make sure that what they're looking at is that best practice. You're welcome.
So, since like 2020, have you noticed more like overdose cases with the suicide?
For suicide overdoses, I'd have to have my actual statistics where it breaks it down. I don't have that in front of me. That is not one of our most common methods for suicide. Our fatal overdoses are accidental or overdoses I can discuss about, though I do have that number in front of me. So our overdose rate has been declining some. It peaked in 2021 at 2022 at 24, 2023 we were at 16, and 2024 we were at 13. And this year we have 3 confirmed. However, we still have about 12 cases that are open waiting for toxicology and autopsy to come back.
Thank you. I was just wondering if it was like related to the COVID lockdowns and things like that.
Some of our suicides are, we do have that as one of our factors that we added during COVID, and there was actually during COVID, that was one of our lowest years for suicide. Let me get back. In 2020, we only had 15 suicides, so I can go back. In 2017, we had 20, 2018, 25, 2019, 25, 2020 was 15, 2021 was 21, and then it went back up to 22, 26, 25, and we are at 5 for this year so far.
And there's a lot of information. I've been using Marathon County Pulse, so you asked a question about overdose deaths. You can actually look that up on Marathon County Pulse right now and get the same information. Like Jess alluded to, we are going to be putting in 2024 very shortly. We're kind of finalizing those numbers, but you can see our drug overdose deaths up on the screen actually right now. But there's a lot of information on there. A lot of the strategic plan values that I'm talking about, in fact, all of them thus far, have been pulled out of Marathon County Pulse. So I think that gets us through, unless there are any other questions, I think that gets us through objective 3.7. We can go to 3.3. So again, you're identified as a support committee here. Just to talk through graduation rates, the outcome measure number 1, by the end of 24, the goal was to have an increase in graduation rates to 93% or above in the county. Again, great information on Marathon County Pulse. You can see, much like a lot of these measures, pretty stable. Marathon County's ability to influence this in terms of direct education, our role is very limited. We do have an obligation under state statute for any juveniles that are out at our juvenile detention facility. We do have the requirement that we facilitate their ongoing education. But as you might otherwise expect, this is really largely a function of school districts. And certainly our ability to partner with them through primarily our social services department, which is why this was identified as a lead objective for Health and Human Services. I think it can have a positive impact there, but again, our ability to directly impact it is more tenuous. Any questions on graduation rate? If you do want to dive in, there's a lot more information there. Sure, go ahead, Supervisor.
I just have a question on calculating that percentage. What about homeschooling families? Are they
I'm-
counted in here, or they are separate? Or do you have calculations on them?
I'm not sure. This, so one very nice thing about Marathon County Pulse is it puts the data source in there. So this data comes directly from the Wisconsin Department of Public Instruction. I will have to look into that question about how is homeschooling put in there, unless Vice Chair Dickinson would know.
It would not be. DPI has no authority over homeschooling. They don't gather that data. It's only going to be public and private schools.
Okay, so are they counted anywhere?
Not that I'm aware of in my experience as a school board member.
Thank you for that answer. Saved me having to look into it. Very good question. I'm not sure about that. I can ask DPI if you want, but I'm not aware of that right now. The second indicator there relates to childcare, and specifically, I'll pull up the strategic plan again. Well, this is outcome measure number 3, the capacity to deliver affordable, high-quality childcare to children in Marathon County will increase. Certainly, the county board has had a lot of conversations about childcare. That, too, is available on Marathon County Pulse. This data comes from Child Caring. Not surprising, the number of total providers, that's another measure here, has been declining in terms of registered and approved childcare. The total number of slots likewise has been decreasing. There was a question at Health and Human Services that I'm still waiting to get some additional information, and I did receive some from Child Caring, what the difference is between the total capacity in terms of number of regulated slots compared to what the need is, and I hope to have that. They did send an email, I just haven't had the opportunity to dive in and really make sure I understand it. But in terms of childcare, another great indicator on Marathon County Pulse. Go ahead, sir.
The money that we provided for people to get licensed childcare or to work for somebody to go through and get the credentials.
Sure.
Has that been
Ongoing.
helping? Yeah.
So that was a request for an update at the Extension Education Economic Development Committee meeting. I did receive an email from Kelly, the Executive Director of Child Caring. To this point, their first cohort is wrapping up, as I understand it, with 4 participants. They are going to make some changes to the program. The second cohort is set to start, in the near future. They're going to try to make some changes to get more people interested to meet their goal of childcare providers. But my understanding is all of the individuals that are currently going through the program are going to be moving forward with employment in that area. So it should have a positive impact, the 4 individuals that are going through right now. But Kelly agreed to give a more substantive update when that cohort wraps up. All right, and then the last piece, which isn't something we have data on Marathon County Pulse regarding, but it is a outcome measure related to out-of-home placement days. So Krista Jensen provided an update, and you can certainly watch the presentation on the recorded YouTube from Health and Human Services. But this is a big push. If you've heard the term Families First Preventative Services Act, that is one of the federal directives that came down quite a number of years ago now, that really does push via the state and then via local social services here in the state of Wisconsin, really does push departments to try to identify the least restrictive form of out-of-home placement, if at all, for children who are in need of protection or services. So when our department investigates, and Mike's office is involved in this, in terms of reviewing, reviewing the recommendations of social services, but our staff really will try to identify as many ways that they can keep the child safe while also maintaining the child in the home of a parent or relative or a like kin placement before placing the child outside the home, and whether that's a foster care placement or any of our other placements that are referenced in the budget document. that you'll see from social services. The other big push in terms of Family First Preventative Services Act, it's not only maintaining, excuse me, just a second. It's not only pushing to maintain the child in the home of a parent, but like I said, that level of the least restrictive placement. The idea is that there's a correlation between maintaining a child in their familial home or a less restrictive placement. It's a more positive outcome for the child. The additional benefit, it's also less costly. I referenced this during my budget presentation. The significant increase, if you go back and look historically over our budgets, the significant increases in cost we've seen for those various placements. On the juvenile justice side, you think about a Lincoln Hills placement, a correctional care placement, those are exceedingly expensive. The same thing is true on the child protection side. The more we can do to maintain children in their family home or a relative placement, it's not only better for the child for outcomes, but it is a less costly endeavor. So Krista provided an update, and she indicated that overall there was an 8% decrease in our out-of-home care utilization from 2023 to 2024. So that's a function of a number of things, including the county boards moving forward with the Family Keys program is one small part of that in terms of maintaining children in the placement with a parent. And like I said before, some of the things we do to try to make sure that we ensure safety through those placements. I know I'm missing stuff, Mike. Is there stuff that Krista referenced off the top of your head that I'm missing?
I can't think of anything that you missed that was worth mentioning at this point.
Yeah. If you do want to watch, the meeting is recorded. Health and Human Services, Krista was there, but I think that's good movement. Again, not only just because it's best practice, it's better for kids, but also has the added benefit of being less costly.
So I have two things on my list from, what is that? 2022. CASA court
Oh, yes.
appointments and special advocates and JET, Judicial Engagement Team. Do we
Sure.
still have those?
Yeah, Mike can talk to both, but yes, our court-appointed special advocate program is a program, it's not a county department, but certainly they work very closely with our social services department and the courts. I'll let Mike talk a little bit about what it is, and I'll just add that our program is growing rapidly.
Sure. So our court-appointed special advocate program, it's actually a creation, the program itself is a creation of Wisconsin statute, and Wisconsin law allows in child welfare cases the court to appoint an individual to provide the court with information about the child, their placement, how they're doing in that placement, some recommendations about how the case should move forward. And that person is not an attorney, guardian ad litem, they're not representing a party. They're specifically a trained volunteer to advocate for the child's best interests. And in Marathon County, our Marathon County CASA team is based on a nonprofit organization. They've been able to train up more than a dozen volunteers to assist in these cases. My understanding is that they've provided a really helpful and unique perspective to the judges, which is really the number one piece of that program, is to give the judges another insight into what is actually happening in the placement, in the home, how's the child actually doing. And I think that perspective has been really beneficial. So from what I hear, it's going really well. Of course, there's probably no world in which we can get 100 or so volunteers, so one in each case, but we have volunteers on many of our cases, and they are doing a really good job of getting that extra information.
Yeah, and I would add that our program, our executive director locally is being challenged by the state to expand the program to be more regional based, for all the reasons Mike just said, that it really is valued by, my sense on the outside is it's valued by everybody that's in the child protection system. GALs, Corporation Council, and certainly the courts. And I think families as well. All right, so if
Anything
there's,
else?
if there's nothing else, we can round out the last support area where this committee was identified, and that's 7.2, as referenced by the vice chair. So you have 3 outcome measures there as well. The first one, by the end of 2024, that we would implement, working with North Central, implement a quality of life measure for all individuals in counseling or mental health programming, AODA programs at North Central Healthcare. So real quick in terms of background, one of the things that North Central used to measure was recidivism, or if people, I should say relapse, not recidivism. If they were going through programming, if they relapsed, well, back when this plan was put in place, one of the things that was discussed is relapse really a sound measure for treatment programs because of its frequency, and ultimately the decision was made, we try to implement a quality of life measure, which again gets at, hey, perhaps you historically we were substance dependent and your use dramatically dropped, but you did recently relapse. That's not a failure, that's still a good thing. So this quality of life measure would try to get at that. I just met with North Central Healthcare staff. This is on the list of things to do, but they've made a lot of headway. If you haven't watched or reviewed the North Central Healthcare budget over the last several years, this is on the list. It just hasn't been a top priority for them to implement as of yet. I will continue to work with them to do that. Outcome measure number 2, by the end of '24, 3% or less of high school students will report having taken prescription drugs without a doctor's prescription in the last 30 days. This data is on Marathon County Pulse, and I know it's up there because I looked at it just a minute ago. Here it is. You'll see that the response rate, the goal of 3%, we're not there, but I think we have, again, you've seen a little bit of a drop. Our life report is out now. This is a measure that actually comes from the Youth Risk Behavior Survey. But we have, our health department does a fair number of presentations and working with local school districts. Right now, actually, we just got a presentation this morning at the Board of Health meeting. One of the big pushes is around vaping and the challenges of vaping in high schools and even in middle schools. But that right now our value is at 8%. And then the last one, which we already talked about, was overdose deaths. So I won't belabor the point, that too is on Marathon County Pulse, but that was a measure that was identified relative to that strategic plan goal. So I know that was a lot in a very short period of time. Happy to answer any other questions, but I think the vice chair teed it up well with really this. I think the goal is the county board wrap up its comprehensive plan this year, which we'll get into later, and then that will then inform or help the county board, I should say, in adopting a new strategic plan sometime next year.
Go ahead, Chris.
Yeah, thank you. The only thing I would say, something to consider as you look into next year, as board changes and everything, committees change, vice chairs change, who knows. Something to consider is a lot of these measures are not measurable, and they can be quite distant from the role of the committee. So put that in kind of the back of your mind to consider as you build the strategic plan next year. And then the other thing I would add is it's something that in the strategic plan, what we'll probably want to do is annotate to a lot of these measures, kind of do a benchmark and then have that information readily available similar to a link or something like that. So then you can really just kind of assess the two together rather than, like we were talking about before, a lot of digging and extra work. But other than that, I appreciate your time. And if you have any questions for me, feel free. Okay.
Any questions? Okay.
All right.
Thanks,
Thank you.
Chris.
I appreciate it, Madam Chair.
So if it's okay with everyone, I think we'll just go on to 7B, discussion of Chapter 7 of the Marathon County Comprehensive Plan. And we have CPZ here to help us out with it. Thanks.
Hello, I know we have a new supervisor here on the Public Safety Committee. I'm Lori Miskimmons. I'm the Director of Conservation Planning and Zoning. And I'll just step back for a minute too, because I'm not sure that everyone in this committee has been through a draft chapter of the comprehensive plan yet. But you may recall last year we did discuss that we are doing the 10-year update of our 2016 comprehensive plan with the goal to update it by February of 2026, and then as Vice Chair Dickinson was mentioning from there, the county board would develop a new strategic plan from that comprehensive update. So in doing that, what we're doing is taking 1 to 2 chapters a month. We go to the committees. Well, first we work with the departments to get some of the updated information, get a working draft in progress. Then we're going to the committees to discuss, the committee of oversight for that chapter, to discuss additional things they want us to consider including or updating as we're working through the draft. We then take it to the executive committee as well, since they're overseeing the update of the comprehensive plan, and then we'll go back, work with staff in the departments again, bring you all back a more complete draft that you'll get to review before we take it out to the public. So right now we're working on Chapter 7, Public Safety, so that is why we're here with your committee today. And it is a working draft, as I said, so there's definitely typos and things in there that we still need to add in and correct, but I'm going to take you through some of the things that are changing in it and then open it up to discussion, especially as it relates to what else you'd like to see us consider for the chapter update, and then the goal, the objectives, and the issues that we've started to identify if you have any other things you want to add at this time. And you don't have to give them all to us today. First, you can definitely email us after the fact too, after you've had more time to think about it, and let us know what else you might want to see changed before we bring that complete draft back to you later this year. So we did work with the Sheriff's Department and the Emergency Management Department to update the chapter. So a couple things you'll see is that we're just referencing updated plans like the hazard mitigation plan that was updated in 2022 and is going to be updated again in 2026, and the integrated preparedness plan. We also talked about that we should probably reference the life report and the pulse data because the Sheriff's Department is continuously working with the Health Department to keep that data set up to date, as you saw today when Administrator Leonard was giving you the update on your strategic objectives that you're working on, so we'll get that into the chapter as well. Then the Sheriff's Office did go through this working draft and update information related to their divisions. A couple things I'll point out that they highlighted or changed down here. I did want to, with the communications section on page 5 or 6 of the draft, I did want to note that just this March we did get our next gen 911 system online. It's just the initial stages of that. So when you guys were talking about 7.1 earlier today, that is something, that's one of those tools that might help with some of that response time, but it is just coming online right now. So it doesn't do everything we want it to do yet, but it could have future capabilities of data and images that could be sent to 911 as well that could help. But the idea behind Next Gen 911 is to definitely help with more seamless response from dispatch to getting emergency responders to the site of the issue. So a couple other things here. We do have some data that we need to bring in from the life report and the pulse data related to crime and correction. So that hasn't been added in yet, but we just have a placeholder in there to get that in. We did, the Sheriff's Department did update some of their information related to the jail facility and our continued I guess I'll say struggles with the census population at the jail, that we're often at capacity and we are still relying on other counties at times to house our inmates, so they updated that data. And they also updated some of the information about some of the jail diversion programs and the Criminal Justice Coordinating Council and some of the efforts that are underway there to either help reduce the jail population or reduce recidivism. Emergency services did also update some of the stuff related to fire services and medical services within the county. And we did add a section to this chapter that wasn't there in 2016 related to the Regional Forensic Center, since that's a new development that is going to be in our county now, so we wanted to make sure to highlight that. And again, emergency management went through and updated things related to hazard mitigation within the county and hazard mitigation planning. And we're still working on that. I noticed one comment we left in there hanging. This is definitely a working draft. There's still a comment in there that says we're still weaving that section together. So in terms of the issues, some of the issues are still the same from the 2016 comprehensive plan related to the jail population, just noting that there's many factors at play when we talk about trying to get the jail census down. It's not just simply the number and just not having people in jail. There's many things we have to consider and balance that need for public safety and the justice system to get people through the justice system within our county. So it's a complicated process to reduce that jail population. So I think the sheriff just wanted to continue to highlight that there is going to have to be cooperation amongst the many public safety departments to get that population down. I know Administrator Leonard in his budget the last couple of years has touched on some of the concerns we've had with training and retention of the sheriff's office staff, so we want to develop and put an issue in there related to that as that continues to be a concern for the county. The drug cases within the county continue to take up a lot of resources for the Marathon County Sheriff's Office, so that was in the 2016 plan, and they wanted to see that stay in the update as well. And then you guys talked about this a little earlier with the strategic plan conversation with the volunteer emergency services. And I think you all touched on this a little bit, just noting that especially at the local level, that is often staffed by volunteers and aging population. And so how are they going to continue to provide those services? And one thing the emergency management director pointed out is just that continued focus on getting local governments and agencies to develop their continuity of operations plans. I don't know if there's anything else you all want to address with more coordinated efforts among those local municipalities as well. As Administrator Leonard mentioned, we don't have consolidated services in that area. So just think about like what it is we think we could help with related to that issue. So. And then the sheriff's office did say that recidivism is still an issue we want to keep within our plan that's carried over from the 2016 plan. As it relates to the goals and objectives, so there's a typo in here. The public safety goal, as it is in the 2016 plan, is the Marathon County is a safe and secure community for all residents and visitors. We were actually workshopping whether or not objective 1, which is to provide cost-effective and high-quality public safety services, maybe would have a better home up in the goal versus being its own objective, in part because I think, as you all were talking about earlier, there's a lot of things that we can't control as it relates to providing cost-effective and high-quality public services. So we were trying to figure out, does that make sense to have an objective based on that or not? So, because where can we have impact and what can we control? Some other objectives that we've been drafting and working on include promote coordination amongst public safety departments to identify efficiencies in reducing jail population, mitigate the impacts of the heroin and methamphetamine epidemics in Marathon County through evidence-based practices, promote efforts that reduce recidivism, improve road safety and design standards, and plan for and identify appropriate measures to be taken related to disaster mitigation, preparedness, response, and recovery. So that's where the working draft is at right now. Like I said, we're looking for feedback related to other things you feel should be addressed in the chapter. If you feel the goal or objectives, what work could be done there or what you'd like to see, and then the issue section as well. And I think one thing that you touched on a lot earlier today too, as it relates to those objectives, I'll just say this again, is we're definitely looking at trying to refine the objectives more relative to what the county can have impact on and control and what we can measure. So we're definitely looking at what we can do there to update those objectives. So with that, I'll open it up for questions and comment.
Go ahead.
So with respect to some of the feedback that I received from municipal police chiefs in particular, with respect to pushback regarding a consolidated model, I think the biggest thing that kind of needs to be communicated is that consolidation doesn't mean removing local voices. It means giving municipalities the opportunity to have more influence on county level decisions. The Sheriff's Department can work with local community leaders to ensure that local concerns are heard while benefiting the larger unified structure that makes the county safer and more efficient overall. In short, while municipal leaders and law enforcement has its merits, the county system provides an expanded platform for accountability and more cost-effective, efficient ways to serve the entire community. And so the central command structure doesn't take away from the connection between the officers and the residents. It strengthens it, making law enforcement more accessible, responsive, and consistent across the county. And, you know, this was kind of touched on before, but I think that's really what the big concern is that a lot of local municipalities like the fact that their town board and the police chief there is responsible or directly answerable to them. And so I think that some of the pushback that's coming is that how can we ensure that that our local leaders are going to be responsible and answerable to those elected officials. And so, you know, I'm very much in favor of a consolidated model as far as that's concerned. And so I think kind of really outlining what the strategic benefits to that are going to be. So for instance, saving dollars by optimizing resources and reducing costs by itself. So one of the things that I saw is that last year there was over 200 law enforcement positions that remained unfilled. And one of the reasons for that, again, this is kind of higher level, but the Wisconsin Law Enforcement Standards Board, which establishes the uniform training and certification requirements for officers, these rigid standards may contribute to some of the hiring challenges faced by local law enforcement agencies, limiting their ability to quickly fill vacancies and meet the specific needs of their communities. So that's one thing to address, but with respect to response time, so saving time through consolidated services, again, that's something that I would really like to put emphasis on because it eliminates unnecessary municipal budget appropriations and reducing the need for municipal committee meetings. The county can fast-track law enforcement contracts, allowing for quicker service implementation. And so that's just one of the things that I've been kind of stewing on and working on behind the scenes, but just something I wanted to put forward.
Okay, other comments or questions at this point?
Are you coming back for the next meeting, or you want comments?
So at this
Email
point,
to
I
you,
would
or-
ask for comments by email or give me a call if you want to discuss it, and then we can take your comments too and try and consider if there's something that could be worked into the chapter related to that, and then we would be bringing back a more complete draft this summer. So.
Okay. Any more questions for Lori? Okay. Thank you.
Yeah, thank you.
All right. I've got my agenda all marked up here. Make sure I go back to the right one. Okay. All right, 6B, discussion and possible action by public safety to forward to the county board for consideration. 6B1, consideration of resolution to the state of Wisconsin relative to state support of circuit court funding. You're on.
Sure, I'll kick this off. It's a little bit of a refresher. You had this presentation. I apologize, just hit the microphone. District Attorney Mayo came before you a number of meetings ago, and I remember kicking this off as well, talking about the what's in your packet, the Criminal Justice Coalition biennial budget proposal. So again, this is an opportunity for the county board to provide advocacy through the state budget development process. So the governor did release his budget. Of course, now the budget is being essentially undertaken anew by the Joint Committee on Finance in the legislature. And this is something that the county board has done in the past, is considering whether or not to, again, take part in advocacy for various objectives within the budget or priorities within the budget. So I'll start with the Criminal Justice Coalition budget proposal. Again, the Criminal Justice Coalition is made up of the State Public Defender's Office, the Wisconsin District Attorneys Association, the Association of State Prosecutors, the Department of Justice, and the Director of State Courts. So all of the primary entities that participate in the operation of the circuit courts or are engaged in the operation of the circuit courts put together a Justice Coalition budget proposal. I won't go through it in detail what all the proposals were. You got this the last time from District Attorney Mayo, as well as myself, talking through things that related to primarily the District Attorney's Office, but also the State Public Defender's Office and the courts. The other item in your packet, and this is Kelly Schremp couldn't be here today. She may be online. She is, perfect. But want to say thank you to Kelly. This is a draft resolution that a number of counties have brought forward. If you took the opportunity to review your December issue of the Wisconsin Counties Magazine, there's a lot of discussion about the operation of the circuit court system, which again is going back to that presentation from DA Mayo and myself. It's really a partnership. It was envisioned as a partnership. The circuit courts, the building we're in right now, the courthouse, is really, it's a state function. The circuit courts are a state function. That said, the county, as an arm of the state, is called upon to carry out a lot of those functions. And over time, the funding for the operation of those circuit courts, as laid out in the resolution and as we referenced at your last meeting, and certainly as elaborated in the Wisconsin Counties Magazine, that funding split has become more and more an obligation of the counties, and that the state share of funding has not kept pace. And that's with respect to the things that the counties do on behalf of the state. So again, for example, all of the employees in the clerk of court's office, those are county employees. They are there to support the state courts, but they are county employees. The judges, on the other hand, and the prosecutors in the DA's office, and the public defenders in the public defender's office, those are state employees. But there are a lot of opportunity, or a lot of areas where, again, the counties take on obligations to run the court system. A really good example is the DA's office. As I said, the prosecutors are state employees. So all the professional staff, the paraprofessional staff, are county employees. So victim witness professionals, those are funded. It's a blended funding stream between the county and the state. So a lot of areas of that overlap. So this resolution that Kelly was able to pull has been adopted by a number of other counties. It really is tied pretty narrowly to the recommendation and the budget, the legislative priority identified by the Wisconsin Counties Association to essentially address that inequitable sharing of costs between the counties and the states, asking the state to put more funding toward the county operations. What it doesn't get at is some of the specific areas where perhaps if you wanted to, you would encourage the state to actually invest in areas where it's a state obligation and the state, perhaps the service level they're delivering isn't where you want it to be. So for example, in this criminal justice coalition budget, you'll see that some of these priorities are for fully funding of the assistant district attorney pay progression. That's entirely a state obligation. That's not one of those areas of shared obligation. That's entirely a state obligation, but you are impacted. The county is impacted if the state doesn't meet that obligation because you don't have, you might have more turnover in the DA's office, or you don't have appropriate numbers of prosecutors, which slows down cases. Similarly, the public defender's office. Their requests in the Justice Coalition budget were for more positions, ensuring that they're paid appropriately, and making sure that those private appointments that I talked about before, that private bar rate is increased to a place where that is more competitive and then allows for cases to move through the justice system. So the resolution that was in the packet, that's why it's got a draft stamp on it, is really specifically to the Wisconsin Counties Association issue that's talked about in the magazine. That is, hey, you need to, the state of Wisconsin, it urges the state to provide more funding to counties, directly to counties, so that counties don't need to put county levy toward these really state programs. But it is silent, or relatively silent, on urging the state to also make sure that it fully funds the areas under its control. I hope that makes sense. Tried to give you a high-level overview, but I know Kelly is on. Kelly, if there's anything else you certainly that you wanted to add, please feel free, but I tried to give that high-level overview.
I don't have anything else. Thank you, though.
And I'm happy to answer any questions. I know as we've talked about with the courts, it's a system and it's a complex one.
So as far as like the levy goes, is the state going to pick up more of the funding and stuff? Is that what we're looking? I'm just kind of get an overview like of that.
So the urging of the resolution, the draft resolution that's in your packet, and I know a number of counties have approved a resolution that is very close to that. Essentially what it does is it calls for the state to increase its budget allocation through the biennial budget by $70 million to counties across the state. What that would allow for counties to do is to take what in Marathon County, don't hold me to this, but I think it's about $1.6 million of levy annually. I can go back and double check, but the county does put a significant amount of county levy into operating the state courts. It would allow the county board to essentially take that levy allocation and really, I would say, reinvest it into other priorities where the county perhaps, where there are county obligations that are outside of state funding. For example, the sheriff's office is largely levy funded. Many of our departments are largely levy funded, and we haven't been able to add positions. One of the reasons that the county board hasn't been able to say, hey, we want to increase our service level in certain areas is because we have these areas like this in the court system where that partnership isn't where it needs to be. I hope that answers the question.
So you said it's like 1.6 million for our county, is that?
Correct.
Okay.
We have a significant amount of Marathon County tax levy that is used right now to support the courts. Another example is victim witness funding. In the district attorney's office, it's talked about in the Justice System Coalition budget request. It was envisioned that would largely be funded by the state when that program was instituted. That percentage of funding has dropped significantly over the last several years, and we've had a couple years where it was about 50-50, but it hasn't been to the level that it was originally envisioned. I believe the Justice System Coalition request is actually to have the state budget fund that to ensure a 60% share be paid by the state, which would be a positive. I mean, that would be multiple positions in the district attorney's office where our share of reimbursement would go from 40%-ish to 60%. That's a benefit. Kelly's talked about at the CJCC the amount of funding that we have to put toward things like interpreters. Our costs relative to interpreters have gone up substantially. Similarly, with respect to guardian ad litem appointments and private bar appointments for attorneys. So to the extent we would get more funding from the state or be able to retain more of the fees that we collect on the state's behalf would allow for that levy contribution to be utilized in different ways.
Thank you.
So I have a couple of questions. One is the jail actually full, or is there lack of staffing that we can't house more prisoners?
So our staffing, I just met with the sheriff this week or last week. Our staffing is in a very good place. We actually are fully staffed in terms of people that we have hired. We have to get them through the training programs that they needed to be able to really do their full work up in the jail. People, if they ask whether the jail is full, technically the number that would constitute a full jail and what we're permitted to have in terms of occupancy, the state puts you're not allowed to really be full. You're supposed to have a certain amount of available space so you can move people around based on classifications and other things. But as was alluded to by Lori, we are functionally full and having to make use of out-of-county housing for inmates. But that is not a new thing. If you go look in the last several budgets, we've actually done a very good job through a lot of the programs that Lori alluded to manage that population. But as I always put in my budget, managing the jail population doesn't mean you just don't incarcerate people that should be, and our judges do a good job on that. I mean, at the end of the day, it's whether an individual is held in custody, that's a determination based on the specific facts of that individual's court case, not a budget determination. We have to fund what we have to fund. Bit of a long-winded answer, but I don't believe we're having issues that are staffing related that are substantively impacting whether or not we house inmates out.
Okay, thanks. I have one more question. So I know I've stated this in here before. All the people that skip their court dates and it has to be rescheduled, that affects a number of people that have to call the victims, all of the victims. Every time somebody skips a court case, they lose the time paid to the bailiffs, to the judge, to the reporter, everything. I mean, everything is a loss if somebody skips their court date. So how would it happen that they can tighten that up and say, okay, you can miss one time. After that, fine goes up, you're incarcerated. I mean, something to quit wasting that money. That is thousands and thousands of dollars that the courts lose every month because of people playing the game and skipping their court dates and rescheduling and then not showing again. So how can that be remedied? And that would help the levy as well.
Complex question. So I know the judges I've conveyed your comment to them through the CJCC before, and it is a complex issue. The decision of whether or not, I'll stick with pre-conviction, right? Because that's what I think you're talking about is when people miss their court dates before their case is resolved. If an individual is out in the community, they're out on bond, whether that's a signature bond or a cash bond that they were able to post. And an individual then doesn't comply with a court-ordered condition to appear, there are a number of things that can happen in that individual case. And one of the fundamental features of our criminal justice system is that at the end of the day, in a lot of areas, the judges have the judicial authority vested under the Constitution and state law to make an individual determination, and they actually are required to make an individual determination about how to proceed in that individual case. So if Lance misses his court date, and you miss your court date, we could very easily be treated differently based on the individual circumstances of our case, both the facts of that case and also the reason for our failure to appear in court. So the idea of adopting this is exactly how we're going to treat every case, my sense from talking with the judges is that there would be resistance to that. And it's rooted in that idea and fundamental principle of the courts and our operating of our justice system that judges are required to exercise their discretion. That said, to your point about can we do things better, I think I'm a big proponent of, hey, let's talk. Are there better ways to do things? And I know that is on the list for the judges to work with, and I think they're going to have to work with certainly the district attorney's office to see what that may look like. And also, one other complicating factor is we have 6 judges. And to the extent they do things similarly, there are occasions in areas where they do things similarly. But there are a lot of areas also where they do things a little bit differently. So the threading the needle is finding a way where we do that appropriately. To your point about whether it's a double-edged sword on some of those things. Certainly moving cases through the criminal justice system, again, I'm a huge proponent of efficiency, and I experienced that firsthand when I was a prosecutor. I know there were things that I did with that aim of trying to get the case resolved in a way that was as expeditious as was appropriate, particularly for victims if they were involved. But finding a way to, if every time somebody missed court, regardless of circumstance, we said, hey, $500,000 cash bond, where you could actually do that, that actually results in a lot more people probably being incarcerated pre-trial than actually need to be to ensure public safety. But at the same time, if you allow people to, as you allude to, perpetually not appear, that slows cases down. So finding the right balance is certainly something I know the judges take it seriously, and I know that certainly the district attorney's office, to your point about calling victims, that is something that they rightly are concerned about. In my last conversation with the judges, one of the judges, my recollection is they implemented a bit of a change where there's actually a certain number of days where there's at least, if a case involves a victim and someone they failed to appear and they want to schedule an appearance to come in and quash their warrant, that there's enough time between that phone call and that court hearing to allow the district attorney's office to make those calls. But that was a very short conversation I had with a judge, and I don't have specifics. That's my understanding of it, so I reserve the right to amend my statement in front of you if I'm inaccurate. But certainly that is an area at the CJCC that I know needs to be further talked about.
Anyone else have any? Go ahead, Nick.
So to your point, so if the state fully funds county budgets and eliminates the need for county taxes and levies, in terms of the tax system efficiency, by centralizing county funding functions under the state, we tap into economies of scale. The state gets better pricing, lower overhead, and can eliminate duplication in services. Economies of scale and better cost management could, in theory, allow the state to fund counties at a less than 1-to-1 tax increase, meaning taxpayers could see a net reduction in overall tax burden. So economies of scale reduce costs by increasing efficiency as the scale of operation grows. When the state takes over county-level funding responsibilities, it can spread fixed costs, leverage bulk purchasing, and eliminate redundancies, leading to overall savings through bulk purchasing power, reduced administrative overhead, standardized services and infrastructure, lower borrowing cost, efficient workforce utilization, centralized technology and automation, which could, result in, especially for the residents of Marathon County, a significant savings overall. And I think that's kind of to your point, is that there are funding responsibilities that, quite frankly, right now are being picked up by the county and that are being mandated. And so there is a fiscal responsibility from the state to ensure that the services that are being mandated are ultimately accounted for and paid for at the lowest cost of the Marathon County resident.
Yeah, so to that point, you have the draft resolution, and I'm not urging you to do anything. My job as staff is to bring information to you. And again, Kelly did a nice job of bringing this draft that a number of counties have used. It addresses enhancing the amount of funding coming back to the county, well, counties throughout the state, for court operations. But it is silent, as I said, on urging the state to allocate sufficient funds to the areas that are its responsibility, which we're impacted by. So again, I go back to, if they don't fully fund prosecutor raises or the number of prosecutors that are needed, or if they don't fully fund raises for state public defender's office or the full number of public defenders that are needed, to Supervisor Hopa's point, criminal justice, the system slows down. So this draft resolution covers the first part, which is counties, we know you do a lot of things on behalf of the state to operate the justice system, and we recognize we need to provide more funding, but it doesn't go to that second part that I just talked about. If you want to have a resolution that kind of gets at both of those pieces, I'd be happy to put some work on a couple of whereas paragraphs and a now therefore paragraph to get at that, but I wanted to at least get this in front of you. As you talked about at your last couple of meetings, this was going to be back on your docket. In terms of where they are in the state budget process, again, it's at joint finance, and they're holding budget listening sessions. So the opportunity for resolutions of this type, I think it's ripe for your discussion.
Anyone else? So you want us to, we don't have to take a vote on this. We're making a recommendation to you to add those paragraphs?
You can do anything.
Anything we
The
want.
world, I think Corp Counsel just stepped out, but
He
he
did.
has said before, the world is your oyster. If you do want to move a resolution forward to the county board for consideration at your April meeting, and you would want me to add some language, my sense would be that a motion to recommend this resolution with language encouraging the state to support sufficient funding for county district attorney's office and sufficient funding to support the state office of the public defender throughout the state would give me enough guidance that I could add those. If you'd prefer just to have a resolution, a more narrow resolution, like the one that's before you, certainly that's in your packet that was provided by Clerk of Court Schremp. Really, it's up to you.
Lance, can I say something real quick?
Absolutely, go ahead, Kelly.
I just wanted to mention that the resolution, the draft resolution that you have is actually the one that was drafted by the Wisconsin Clerk of Circuit Court Association. So that one is actually the one that all counties, I believe, are sending out to the legislature. So I don't mind if you change it or add anything to it, but that's the wording that we came up with.
Thanks, Kelly.
What is the pleasure of the committee? Go ahead.
I
Yeah,
make a motion to go ahead and add as you see fit to just make a motion, just do what you got to do because they need more money.
And bring it back to our committee in April to approve or edit.
Yes, and bring it back, please.
And anybody want to second that? Okay, second by Nick. Any more discussion? Is that direct enough for you?
I think so. I can bring if the idea is you want it back in, we can take it at your May meeting, so you can,
Oh, that's right, this April already.
so I think the state budget's not going to be done by May, so you'll have time. I just wanted it to get on your agenda. If you did want to move it forward to county board for this month, I would interpret your motion to forward this resolution with language that also encourages sufficient funding for county district attorney's offices and the state office of the public defender. I can add those 2 paragraphs. But that's if you want to do it in April. If you want to have me draft something and bring it back for May, that's
Do you want to
easier.
include that in your resolution to have it go to county board this month?
If we still have May to go, if it'll still be in time, I would say bring it back
Okay.
in May.
Perfect, I can do that.
Okay, is that okay with the second? All right. Okay, any more discussion? All in favor of the resolution or changes to the resolution, please say aye. Aye.
Aye.
Opposed? Okay, that is passed. I know you will do a good job. Okay, number 8, next meeting date and time, announcements and future agenda items. A, committee members are asked to bring ideas for future discussion. And B, next meeting Tuesday, May 6th, 2025 at 1:30. And we need, you have a question? Go ahead.
Lance, with the number of counties starting to take state inmates, are you having a harder time finding places to send people?
Can you ask that again?
There's a number of counties I know that are taking state inmates. Are you having a harder time finding places to send people? Or is it,
I don't have specific information on that. I did, like I said, meet with the sheriff earlier. We can put that on your agenda for next meeting to have an update relative to out-of-county housing and state transfers to state prisons.
Okay, any more questions? All right, and we'll take number 9. If you want to go home. Okay, motion by Jason and second by Nick. Okay, all in favor of adjournment, say aye. Opposed? We're adjourned. Thank you, everybody. Thank you, Yi. I know he's still there. Probably fell asleep already. Oh, good Lord.